Good morning, everyone. I'm Rebecca Vickers, and on behalf of the Florida Alcohol and Drug Abuse Association, welcome to today's webinar entitled Drug Usage Trends Annual Report. This webinar is being made available through a collaboration of the Florida Department of Children and Families, Office of Substance Abuse and Mental Health, and the Florida Alcohol and Drug Abuse. Please note that as an attendee, you are in listen-only mode and will only be able to view your name. If you have questions, please send them to the presenter and me, the host, by using the chat panel. The button to open the panel is usually located in the lower right side of your monitor. Please use the chat panel to send any questions you may have as you think of them, and the presenter will address questions as time permits. Our audio is broadcast through the internet to your computer. If you experience poor computer audio, there are a few options to try on screen right now, and these options will be posted in the chat panel throughout the presentation. If you continue to experience poor computer audio try rejoining the webinar and use I will call in telephone option. You must be connected to the audio of this presentation and view it on screen as well to receive a certificate of attendance. The recording and materials used in today's presentation will be available on FADA's website 30 business days. To access the recording and PowerPoint, go to www.fada.org, then to our Resource Center, and then to our training library. FADA produces many webinars and workshops through the support of the Florida Department of Children and Families. To help participants track credits earned through attendance, we host an online community that provides a personalized digital journal where participants can maintain statements of credits for workshops and webinars taken through the Florida Alcohol and Drug Abuse Association. At the end of today's webinar, the web browser will direct everyone to an evaluation form on FADA's website. You will first need to register or sign into your account to complete the evaluation. Information you provide FADA as a part of registering remains confidential. Statements of credit will be posted 30 business days after the evaluation closes for persons completing the evaluation and attending the full webinar. Completing the evaluation is necessary to receive CE credits or to access your statement of credit. Please note that the evaluation will close midnight, Monday, June 20th. And please note that we are not able to open the evaluation after the 3 days have passed. Up to 2 continuing education credits are available for participating in today's webinar for persons licensed through the Board of Nursing, the Board of Clinical Social Work, Marriage and Family Therapy, and Mental Health Counseling, and for persons credentialed through the Florida Certification Board. If you are a licensed healthcare practitioner, be sure to include your Florida license numbers for reporting to CE Broker when you register with our site for the first time. If you are certified with the Florida Certification Board or licensed outside of the state of Florida, you do not need to provide your certification number when you register with our site. Please note that WebEx monitors arrivals and departures of attendees and provides a report upon completion of the event. We are not permitted to provide a certificate of attendance if you do not attend the entire webinar, and we are not permitted to provide partial CE credit. Benjamin Hackworth has over 4 years of experience providing community presentations, technical assistance, and training on substance use and mental health prevention services. As an independent contractor, he collects, analyzes, and evaluates data for local, state, and national dissemination through written reports and oral presentations. Ben previously contracted with the Center for Substance Abuse Research as a Sentinel Site Epidemiologist for National Drug Early Warning Systems, funded by the National Institute on Drug Abuse. Ben graduated with a Master's of Public Health from the Northwest Ohio Consortium for Public Health, a joint collaboration between the University of Toledo and Bowling Green State University. His specialization is with health promotion and education. And now I'd like to welcome our presenter, Ben. I will turn the presentation over.
Hi, good morning, everyone. Thank you, Rebecca, for the great introduction. I really appreciate it. So today we'll be going over the annual report on patterns of and trends in substance use Florida, sponsored by the Florida Alcohol and Drug Abuse Association and the Department of Children and Families. So I'm really excited to go over um, some update data, and some new data to present to you, and to have this information um, given to you, and so that you're more informed on what's going on in the US and in Florida as well. So today's webinar will be having some objectives that I hope we accomplish by the end of the session. And the objectives for this presentation are as follows. So we hope to identify updates in substance use trends in Florida youth and adults. Second is to understand patterns of substance use regionally and statewide. And then lastly, understand misuse, morbidity, and mortality trends in Florida. So this is the 2022 annual report, which offers new substance use data from the 2021 annual update report. We will discuss substance misuse among adults and youth in Florida and across the nation. We'll also highlight the opioid epidemic during the height of COVID-19 pandemic in 2020. So most of our data comes from 2020, and so that's why we're going to go over the data from 2020 and also cover what occurred in 2020, as we all remember, which was COVID-19, or at least the height of COVID-19, and also some provisional data that has just recently come out this past month or two from CDC for 2021. So just to briefly go over the main data sources that I used for this presentation, a plethora of data came from the CDC, also Florida Health Charts, the Florida Medical Examiner's 2020 annual report, and also the National Survey on Drug Use and Health. So the Florida Department of Children and Families, or DCF, contracts with 7 regional systems of care known as managing entities to provide behavioral health services throughout the state. Because Florida is such a large state with a diverse population, this model shows each managing entity to respond to the specific behavioral health needs of its region within Florida. Since some of the substance use data that will be displayed here is written out by managing entity, it's important to have a good understanding of these 7 managing entities. So Northwest Florida Health Network in blue serves the smallest population with 1.5 million people, or about 7% of the state's population, and is dispersed throughout a larger geographic area known as the Panhandle. Lutheran Services Florida makes up the Northeast and part of Central Florida in yellow. This is the second largest area by population, making up 18% of the state's population. Central Florida Behavioral Health Network, labeled as Suncoast, serves the largest population with over 6.1 million people, or around 28% of Florida's population. Central Florida Care's health system is represented in orange, serving 13% of the population. Below that is Southeast Florida Behavioral Health Network, serving 10% of the population, followed by the smallest managing entity by population, Broward Behavioral Health Coalition, serving Broward County. And lastly, Thriving Mind South Florida, only serving 2 counties, but making up 13% of the state's population. So it's important that we're going over this just to identify your managing entity that you live in or work in, and also when we go over specific data, knowing the difference between each region and the substance use needs in those regions and managing entities as well. So to get right into the data, we're gonna go, the next couple of slides, we'll go over the 3 most used substances among youth and adults. All the data presented are from self-reported surveys from the National Survey on Drug Use and Health, Florida Youth Substance Abuse Survey, and the Florida Youth Tobacco Survey. These surveys indicate the prevalence of past 30-day use, past year use, or lifetime use presented for the substances that are most commonly abused and or used. Some of these substances can result in substance use disorder or can lead to other types of substance use addiction. The patterns and trends in use for various substances are shown in Florida alongside with the prevalence in the United States as a whole for comparison. And just to let you know that these patterns and trends of substance use are shown among youth and adults. So for youth, we're looking at those who are 12 to 17 years old. For the most part, for the National Survey on Drug Use surveys, and then for adults, it's anyone over 18. So the first substance we'll go over is alcohol. And alcohol use, as we know, is pretty common in the United States. However, consuming too much alcohol can result in a range of negative health consequences. Risk of negative health impacts such as engagement in risky and or violent behaviors can result from misuse of alcohol. Other health consequences with misuse of alcohol may result in alcohol use disorder and with the possibility of death with complications. With the popularity of vaping, which will be our next substance we'll talk about, there's a lot of popularity right now with vaping either nicotine or vaping marijuana rather than smoking traditional cigarettes. And vaping has become somewhat of a forefront substance, especially with concern for youth, vaping nicotine and eventually becoming addicted to nicotine. In fact, in 2008, the US Surgeon General declared youth vaping a public health epidemic. And has since, I'm sure we've seen so many public health awareness campaigns and so forth regarding vaping and the dangers it has on our youth. For marijuana, this will be our third substance we'll focus on in this section. And just want to highlight that marijuana use, although is becoming legalized either recreationally or for medical use, or has been decriminalized in general, there are still some short-term and long-term risks of marijuana use, and can also be abused as well. So the first substance, again, that we'll jump into is alcohol use among adults. Shown in this slide here, this is from the National Survey on Drug Use and Health. And this is broken down into 2-year averages. So for example, 2015 and 2016 averages are shown here. So for Florida, the the 2-year average for alcohol use among adults was at 57.3% versus the US at 55.5%. And so again, as you see here, the alcohol use among adults in the US and across Florida is shown here from 2015 to 2020 in the 2-year averages. And this is for past year use as well. So past year use of alcohol has decreased for Floridian adults to the lowest past year use for 2017 to 2018 at 54.2%. Then by 2020, we see an increase to 55.7% of adults in Florida who use alcohol for the 2019-2020 average. While use among adults in the US was at its lowest in this time frame, shown between 2019 and 2020. There's also been a lot of ongoing research regarding an increase in alcohol consumption during the pandemic. The pandemic has brought on a lot of high stress events, like the uncertainty of the pandemic during 2020, and may have led to individuals to turn to substances, specifically alcohol. So there's been a lot of self-reported surveys indicating that an increase of alcohol consumption occurred during the pandemic. And some survey findings showed that some specific populations, such as women, Black individuals, and households with children, actually increased their alcohol consumption during the height of the pandemic. Another survey indicated that nationally, people were drinking before 5 p.m. during the week, which kind of makes sense. If you think about it, when so many people were working from home, or they were laid off and at home, the access and availability of alcohol in your home increased, and so that probability of drinking before 5 p.m. during the week it makes sense. And I just bring these other self-reported surveys to your attention just because with concern with short-term and long-term effects of this increase in alcohol consumption. So more people could turn to alcohol as a coping mechanism. And we know that with prevention, we're trying to help people cope with positive mechanisms versus turning to substances like alcohol. Another concern is that more people could be classified as heavy drinkers and not really realize it because of the amount of alcohol they're consuming more during this height of the pandemic, and it's kind of like the new normal to them. Also, many may increase their chances of having alcohol use disorder, which can lead to alcohol-related and cause deaths, which, by the way, alcohol-caused deaths is on the rise in Florida, according to the medical examiner's data as of 2020. So alcohol use to me is one of those, it's always been a forefront for individuals across the board, but I think during the pandemic, this has kind of escalated more, and we've seen a higher alcohol consumption, especially during the height of the pandemic. So alcohol use among Florida youth, according to the Florida Youth Substance Abuse Survey, is shown here. This we've seen a steady decline in alcohol use among youth for both lifetime use in orange and past 30-day use shown in the blue line. Since 2010, lifetime and past 30-day use of alcohol continuously decreases among Florida youth. Similar patterns occurred for binge drinking as well, with declining prevalence rates among Florida youth since 2010. And one interesting thing about alcohol use among Florida youth is the distinguishing uh, distinguishing the difference between use among female and male youth in Florida. So looking more in depth in the Florida Youth Substance Abuse surveys, I found it really interesting to look at female versus male use of alcohol. And for both lifetime and 30-day use, females had a higher rate of use for alcohol and can be tracked all the way back to 2010 as having higher rates than males. So over this 10 years of data that we've had, this trend data indicates that Florida females in middle school and high school combined have higher rates of alcohol use than their male counterparts. Another variable that we can look at through these surveys are race or ethnic groups. And we can find that through the surveys, alcohol use is highest among white non-Hispanics, followed by Hispanic or Latino, and then African Americans. And that's overall for both male and female. So going to the next substance, we'll focus mostly on youth, since this has been vaping has been such a important topic among our youth. So the Florida Youth Tobacco Survey does annual surveys for Florida youth in public middle school and high schools during the spring. Almost 9,500 students participated in the 2021 survey. And the number of students were split pretty evenly among high school and middle school students as well. So this is a pretty good considered considerable representative sample of the entire middle and high school population in Florida. So we see on the chart the decrease in use of vaping from 2015 to 2017, and then a slow increase in to the height of lifetime use in 2019 at 27.9%. Since 2019, Florida youth have decreased lifetime use of electronic vaping, with currently 23.4% of Florida middle and high school youth ever using vaping in their lifetime. So with the same survey, they asked students about their current use, or otherwise known as past 30-day use. And current use of electronic vaping from the same period looks similar to lifetime use from the graph that we just looked at for vaping among Florida middle and high schoolers. In 2017, we see that students had the lowest percent of those who used in the past 30 days at 9.8%, while the highest point of use in the past 30 days occurred in 2019 at 16.6%. After this, the percent of youth who vaped decreased to 12.8% as of 2021. And so um, the Florida Youth Substance Abuse Survey is another really good survey that recently started asking Florida middle and high school youth about vaping. And in previous survey years, um, whether youth were vaping, they were um, they were asked if they ever used a vape in their lifetime or past 30 days. But interestingly, the survey actually separated the vaping questions to ask students whether they were vaping nicotine versus vaping marijuana. And so as of 2019, well, that's when these questions were asked in the surveys. And so first we'll look at vaping nicotine among Florida youth. And with the separation of the survey questions beginning in 2019, we see that youth who vaped nicotine in their lifetime was at 23.5%, and it has slowly decreased to 22.5% in 2021. Current use or past 30-day use of vaping nicotine is at a smaller percent than lifetime use, and sees a similar decreasing trend from 2019 to 2021, from 12.5% to 11.2%. Some other findings from the survey, from looking at various variables to consider for vaping nicotine and vaping marijuana, are that youth, a lot of older youth, use more, are more likely to use a vape pen or any other electronic cigarette more than the younger youth. Um, so grade 11 and grade 12 had the highest percentage of use among vaping nicotine and marijuana versus, middle school and freshmen and sophomores as well. Also, some other variables to look at would be race. So we have a higher rate among white non-Hispanics overall, and also a higher percentage of females are vaping nicotine over their male counterparts. And interestingly, vaping nicotine among males is decreasing while females increase their use of vaping nicotine from 2020 to 2021. So I think that's something interesting to look at, is that males continue to decrease their use while females just recently increased use as of recent survey data. So as I said in the previous slide, the Florida Youth Substance Abuse Survey started asking students about, separated the question and asked students about nicotine and marijuana. So this is the vaping marijuana among youth. Among this survey, you'll see lifetime use increased slightly in 2020, but now in 2021, it's at its lowest rate at 14.9%. While current 30-day use has decreased to 6.7% in 2021. And if you're a data nerd like me, you may have noticed that a smaller percent of Florida youth vape marijuana versus vaping nicotine. So that's also something to consider when you're, if some of you have, you know, prevention awareness or campaigns, or are in the school districts. Students are more likely to, according to these surveys, use vape nicotine versus vape marijuana. And then for vaping marijuana, again, we see a higher use among females overall, and also white non-Hispanics as well. So going on to the next substance will be marijuana use among adults. Again, this is from the National Survey on Drug Use and Health. And so this is past month use of marijuana among adults in the US and Florida. And we see that it's increasing throughout this time period that is shown here. And also, according to the surveys, past year use among adults is also increasing and slightly higher as well. So current past 30-day use and past year use is having parallel trends where we're seeing this increase and the height of marijuana use among adults as of 2019 and 2020. In fact, marijuana is the only substance to continuously increase among past year and past month use among adults in Florida and across the nation. And it's the second most used substance among adults behind alcohol. Marijuana use among Florida can also be seen here through the National Survey on Drug Use and Health. So past month and past year marijuana use among youth has been slowly decreasing over time since these 2-year averages shown here. Specifically during the 2016 and 2017 2-year average, where we see Florida at 7.5% for current day use and the US at 6.5%. So according to Florida Youth Substance Abuse Survey, which is another survey that asked about marijuana use, lifetime and current 30-day use is also decreasing, but at a very slow rate. Prevalence rates among racial groups are closer, but white non-Hispanic still have higher rates over Hispanic and African American Florida youth. Males overall had higher rates than females up until 2016, according to the survey. And then females surpassed their male counterparts for lifetime and past 30-day use of marijuana and currently has higher rates. So we went over prevalence rates from self-reported surveys for some of the most common substances used in Florida among youth and adults. And so the next portion of this presentation will go over opioid misuse, morbidity, and mortality, specifically touching on prescription opioids, heroin, and fentanyl. So the current drug epidemic is looking pretty bleak, unfortunately, and I'm sure many of you are already aware of this or have heard in the news the amount of drug overdose deaths occurring across the nation and in your communities. Overdose deaths from opioids, synthetic opioids such as fentanyl, psychostimulants like methamphetamine, cocaine, and natural or semi-synthetic opioids like prescription pain medication all have increased from 2019 to 2020. There's been a 30% increase in drug overdose deaths in the US from 2019 to 2020, from 72,000 drug overdose deaths to over 93,000 in 2020. Drug overdose numbers show that overdose deaths were on the rise in 2019 and early 2020, but the pandemic may have escalated overdose deaths even more. And so that's something that researchers are looking into more is, the fact that overdose deaths have increased tremendously during 2020, and the fact that we were dealing with the pandemic um, just escalated these overdose deaths, but we were already on a increasing trend anyways with past overdose deaths that we were seeing. But the pandemic just basically escalated these overdose deaths. The mental health and substance use treatment communities also were in a crisis dealing with this pandemic, and also dealing with their clients as well during the height of the pandemic when we were all, supposed to stay in shelter and kind of not knowing what was going on during this time. And so it's been a really difficult um, time for people in the mental health and substance use realm to try and assist their clients um, when they're supposed to be, social distancing and not being able to support their clients and so forth. And so not having that support system has really been detrimental to these this mental health and substance use community that's trying to help these people who have addiction or have a mental health disorder. And so it's been a really unfortunate time. I'm sure many of you are in the weeds. So I know I'm preaching to the choir. So, um, but I digress. So with all this, we've seen the increase um, in overdose deaths, and also dealing with the increase of fentanyl in on the streets and the productivity, the lethal dose of fentanyl has just increased tremendously. And I'm sure many of you, again, have been noticing this and seeing this in your regions or your communities. And fentanyl is making the drug scene just so much worse and is really the driver for these these overdose deaths and the increase that we're seeing um, currently. So to continue on, what's even more worrisome with all this information is that the CDC estimates a 15% increase in drug overdose deaths from 2020 to 2021, with a record high of over 100,000 deaths. One thing to point out is that the surge of deaths is lower from 2020 to 2021, with a 15% increase versus a 30% increase from 2019 to 2020. So basically the overdose surge was shown to be lower from 2020 to 2021 versus 2019 to 2020. So that's somewhat good news. If we need to have some sense of light at the end of the tunnel with all this, but overall we're seeing record numbers of overdose deaths, and having seen these numbers over 100,000 deaths in one given year. This is the highest total we're seeing in U.S. history. It's estimated that in 2021, there was an overdose every 5 minutes across the US. And again, harping on fentanyl, this illicit drug that we're noticing a lot more being adulterated in our substances, was involved in over half of these overdoses as well. So again, all this data and information is just showing that the pandemic really escalated overdose deaths, and also fentanyl is just reaping our communities in Florida and also across the nation as well. So specifically for Florida, in regards to drug overdose deaths, Florida also saw an impact from the pandemic, obviously, and the surge in drug overdose deaths that resulted from illicit opioids like fentanyl. So Florida wasn't spared, with having an influx of fentanyl that arrived in your communities and regions. It's infiltrated our streets, and it's really it's been everywhere. Florida experienced a higher percent of drug overdose deaths compared to the US, with a 37% increase in overdose deaths from 2019 to 2020, with almost 7,600 drug overdose deaths in Florida for 2020. Just like the US overall, a smaller percent of drug overdose deaths was observed for 2021, with the provisional data that we have thanks to the CDC. However, total number of deaths are estimated to reach over 8,000 in Florida. Florida also has the second highest number of total drug overdoses in the country. So just looking at the total number, we have the second highest in Florida for drug overdose deaths. And so for Florida specifically, and comparing it to the US, it's pretty similar data. We see that the biggest increase in overdose deaths from 2019 to 2020. However, we're still topping our records as of 2021 with the provisional data that we have, with over 8,000 deaths in Florida, which has never been seen before in our state. This slide shows the drug overdose death rate in the US and Florida per 100,000 population from 2015 to 2020. Total drug overdose deaths in Florida began increasing in 2015, which was basically the start of the opioid and drug epidemic, and continued on to increase through 2017 until a decrease was observed in 2018. Once again, however, drug overdose deaths increased in 2019 and 2020 with over 7,000 drug overdose deaths in Florida. The drug overdose death rate per 100,000 population shows that in 2015, the nation and Florida had about the same drug overdose death rate at 16.2 and 16.3 respectively. But Florida has since stayed at a higher rate from 2016 to 2020, ending calendar year 2020 with a death rate at 35 and the US at 28.3. So we're seeing somewhat of a higher separation now as of 2019 and especially 2020 with the death rate between Florida and the US. Again, we can look at drug overdose deaths in Florida during this time period where the epidemic kind of began in 2015 all the way to 2020. This is also a different secondary data source that I wanted to pull just to have multiple sources for you to look at. So the numbers are slightly different, but they're pretty much the same. This is data from the Florida health charts, by the way. And so again, this is a good secondary data resource to utilize to get Florida specific data. If you're curious about your county that you live in to get more specific data, you can also go on this website and look for drug overdose death poisonings as well, and get a better picture for your county. So again, we see this increase from 2015 to 2017, the decrease in 2018, and then starting in 2019, we saw the increase, and again, seeing that increase over 7,000 now in 2020. And possibly, again, as provisional data says, according to the CDC, an even higher amount of drug overdose deaths for Florida for 2021. And also just looking at this from this time period, as I said before, the drug epidemic, specifically on opioids, kind of began in 2015, and from 2015 to 2020, we've seen a 130% increase in drug overdose deaths in Florida between this time frame. So just the amount of deaths from overdoses is as you know, a continuous problem throughout the years. So we can also, so those past two graphs were specifically talking about drug overdose deaths, so all drugs involved. And this chart specifically looks at opioid overdose deaths from 2015 to 2020 in Florida and the US. So opioids remain the most common cause of death among fatal drug poisonings across the state and nation. And the patterns and trends in overall drug poisonings rates are largely driven by opioids. Specific opioids driving this trend has changed over time. As we know, the epidemic has been described in 3 waves, as some of you may know, starting with prescription opioids, then heroin, synthetic opioids like primarily illicitly produced fentanyl, which we're currently dealing with right now. And the number of fatal opioid overdose deaths mirror drug overdose deaths trends in Florida. So with that being said, we can see here in this chart that opioid overdose deaths kind of have that similar pattern that the drug overdose deaths graphs had as well in the previous slide. So they look pretty similar. And also we notice again that Florida is having a higher death rate of opioid overdoses versus the US. So in 2015, we see here Florida had a 13.1 death rate versus 10.4 in the US. And Florida has had a higher rate throughout all these years as well, ending 2020 with 29.9 death rate and 21.4 death rate for the US in 2020. With the provisional data that we have from the CDC, we're also looking at higher death rates for opioids in 2021 as well. So we're more most likely going to see an increase, a continuous increase, I should say. So specifically just looking at opioid overdoses in Florida, from 2015 to 2020, over 4,000 fatal opioid overdose deaths were observed in 2017 and 2019 as well. But in 2020, Florida saw the highest number of fatal opioid deaths with over 6,000. In 2020, Florida almost reached a death rate of 30 for fatal opioid overdoses. So again, this is a secondary data resource for you to look at. This is from Florida Health Charts. So again, as I said, the numbers are slightly different than from what the CDC presented, but still really good data and still shows the similar trends that we're seeing in Florida. And like I said, you can go on this Florida Health Charts and look at your county and what the overdose death rates and the total numbers are specifically for your county. So we kind of talked about mortality with drug overdoses and opioid overdoses, and some other issues that present with the misuse of drugs and the overdoses that we're seeing in our communities are having an impact on our emergency department visits as well. So as you remember, again, during the height of the pandemic, we were hospitals and emergency departments were dealing with COVID cases, but unfortunately, during this time, the number of overdoses that emergency departments were seeing also saw an increase during the height of the pandemic. So very unfortunate time to see this increase during COVID-19. And so this burden on emergency departments is shown here for all drug non-fatal overdoses that we're seeing in Florida. So Florida, again, we're looking at this the same time frame, and we see an increase, an increase to over 41,000 emergency department visits in 2017, and then the decrease for the first time in a while occurred in 2018. And again, we see the increase in 2019 and 2020. So something interesting to look at this is the similarities of drug overdose trends and opioid trends as well. So it looks pretty similar to the previous slides, right? And so in 2019, the number of emergency room visits for non-fatal drug poisonings increased to over 40,000 and continued to increase for 2020 with over 45,500 visits. So about half of the emergency department visits have been due to opioid-involved non-fatal overdoses. In 2017, the highest number of non-fatal opioid overdose visits were recorded at over 18,000. However, the number of non-fatal opioid overdose emergency department visits surpassed this number in 2020 with 21,277 visits for a non-fatal overdose. So again, we're seeing similar trends and also seeing an increase in emergency department visits for these non-fatal overdoses, and it's impacting and putting a burden and a strain on our hospital systems. So I think this is a good stopping point for now, and is that okay with you, Rebecca?
Yeah, that's perfectly fine. So we will meet back here at 11:03, and I'll put it in the chat for everyone.
Okay, great, thanks.
Hey everyone, and welcome back to today's webinar. I am going to pass the presentation back over to you, Ben.
Okay, sounds good. Before I go back to the slides, I do want to address a question in the chat that we had. Uh, we'll have more time for questions at the end, but just since there's one question, I do want to address that. So someone asked, is there a possible lower death surge in I'm assuming they meant in 2018 due to naloxone and its availability. Um, so I would love that answer as well. That's something that I've been curious about too, is why was there a decrease in 2018? And so um, I think I think we can assume that naloxone and, the availability and access to naloxone has increased tremendously. Um, and it's, been very helpful for first responders and, um, family members and so forth. And so I think you know, during the height of when all this began, kind of in 2015, 16, and 17, I think more and more resources were put out into our communities, statewide and nationally. And so I think we can assume, naloxone may have had a part, but we can't necessarily pinpoint it to that. There's not really good data out there to support that. Um, at the time too, because I've worked on different grants, it's kind of hard to have first respon first responders, you know, detail how many or record how many naloxone or Narcan they're using, how many are, have revived a life, are these repeat users, the data is just not there to support that answer. Um, so we can't really pinpoint it to that. But um, also, another thing to consider would be that the potency of the drugs that we're seeing right now in the drug scene has increased tremendously. So maybe at that time in 2018, we weren't seeing as much, such a high potency of fentanyl or these other substances that we know as of 2019 and 2020, even today, we're seeing fentanyl mixed into so many drugs like cocaine and, um, fake fake prescription pills, methamphetamine as well. So I, um, yeah, that question, um, I think is a really good question, but I don't think we can, pinpoint it to naloxone helping that decrease. But I think, it is a helpful um, resource to have, and I think it has helped a lot of people not overdose and um, may have somewhat contributed to those numbers in 2018. So that was just one question in the chat I wanted to address first. But again, we'll go over more questions later on. Um, so the next couple slides will go over the medical examiner's annual report from 2020. Um, during this time of me creating this presentation and writing this report, they actually released a 2020 update, or sorry, 2021 update. So if you're more curious about the current data, there's actually a new report up, but at the time of writing this, we had 2020 data available for us. And so to go into more detail about the first wave of the opioid epidemic really began with overprescribing, misuse, and in turn abuse of prescription opioids. Three prescription opioids that the Florida Medical Examiner specifically outlines in its report are oxycodone, hydrocodone, and methadone. These specific prescription opioids are put into the annual report in more detail with statewide graphs and regional graphs as well. And so when we look at this chart, oxycodone is shown in blue, hydrocodone is shown in orange, and methadone is shown in green. And so I just combined these three prescription opiates per managing entity. And so some things that you may find here is the total amount of differences that we see across the regions. Also take note that oxycodone-related deaths are most common among all managing entities other than the Northwest Florida Health Network, where oxycodone-related deaths are more commonly seen in this region. So the first region you see there, hydrocodone, is more common among those prescription drug deaths. And overall, it's also important to see the differences in the rates as well, since we have such a difference in population among these different managing entities. And so the breakdown by death rate per managing entity looks as the following. So Northwest Florida Health Network has a death rate of 11.2 for these three prescription drugs. Lutheran Services Florida has a death rate of 11.4. Central Florida Behavioral Health Network has a death rate of 11.9. Central Florida Cares has a death rate of 8.5. Southeast Florida Behavioral Health Network has a death rate of 9.6. Thriving Mind South Florida has a death rate of 4.9, and then Broward Behavioral Health Coalition has a death rate of 5.4. Drug-caused deaths are shown in this slide from 2015 to 2020, according to these three prescription opiates that we looked at in the previous slide. Again, the rate is calculated per 100,000 population for the state of Florida. The highest rates for all three specific opiates were recorded in 2016. Again, oxycodone is the prescription opioid that caused the most deaths among these three prescription opiates that the medical examiner reports out more in detail. Heroin contributed to the second wave of the opioid epidemic. And heroin-related deaths in Florida have increased since 2012, as you can see here on this graph, and reached an all-time high in 2017 with 1,057 heroin-related deaths. I also want to point out that you'll see on this graph that this counts the number of occurrences. So the medical examiner determines if a substance caused the death, as well as if a substance was present at the time of death. And so those substances that caused and were present at the time of death are counted for the number of occurrences. So I just wanted to explain that as well. So the first decrease in heroin-related deaths occurred in 2018, as we did with other drugs, substances as well. But the thing with heroin is that it has since remained stable. However, another decrease was observed for heroin-related deaths for Florida in 2020. And it's kind of interesting to see this downfall of heroin, since this was a part of the second wave of the opioid epidemic. But other drugs may have become more available and more potent than heroin, like fentanyl, for example. In fact, there were 0 deaths with heroin alone. So all deaths with heroin were accompanied by another substance. So polysubstance use is also a big issue as well. So again, looking at heroin-related deaths by managing entities, in 2020, we see the number of occurrences by the regions. And to look more specifically at the death rate per 100,000 population, Northwest Florida Health Network had a death rate of 5.2. Lutheran Services Florida had a death rate of 3.7. Central Florida Behavioral Health Network had a death rate at 4.2. Central Florida Cares Health System had a death rate of 2.1. Southeast Florida had a death rate of 6.6, which was the highest death rate among all of the managing entities. Thriving Mind South Florida had a death rate of 1.5, which is the lowest. And Broward Behavioral Health Coalition had 6.1. So increases in deaths due to synthetic opioids, mostly synthetic fentanyl, began the third wave of the opioid epidemic. Fentanyl and fentanyl analog related deaths increased dramatically starting in 2015. For 2020, there were 7,785 fentanyl and fentanyl analog related deaths in Florida. Something that I think is interesting about fentanyl, not specifically for Florida, but for the US in general, the DEA actually seized more than 12,000 pounds of fentanyl in 2021. So they said for that year and that amount, this is the record amount that they've ever seized in U.S. history for that amount of 12,000 pounds of fentanyl. And the DEA also stated that this is enough fentanyl to provide every person in the U.S. with the lethal dose. So, however, we have the DEA and other enforcement agencies that are seizing drugs and helping stop these drugs getting on the streets in our communities. Even though this is a good thing, public health experts say that this isn't the only measure that will stop the epidemic itself, though. Another um, thing to take into consideration with fentanyl is that um, we're seeing more reports of drug cartels in Mexico using chemicals from China to mass produce and distribute fentanyl and meth across the US through the borders, planes, and ports as well. These Mexican cartels are also mass producing pills to make them look like they're real oxycodone, hydrocodone, and Percocets. Even Adderall is falsely advertised um, and has been shown to have fentanyl in them as well. And they're marketing them as if they're real pharmaceuticals when they're not. So um, with all of that being said, we're seeing such a huge increase in fentanyl deaths, and you know we're seeing throughout the U.S. and in Florida these issues of um, you know law enforcement finding all these drugs being transported into the U.S., the amount of fentanyl that is being adulterated and mixed into other substances and sold as um, falsely advertised. So these are some reasons why we're seeing such a huge increase in the U.S. and in Florida as well. As these numbers, this graph looks startling, right? We went from over 5,000 fentanyl and fentanyl analog related deaths in 2019, and now we're at over almost close to 8,000 related deaths with fentanyl in 2020. So we're just continuously seeing this increase in fentanyl and how it's impacting the amount of overdose deaths. So when we look at fentanyl and fentanyl analog related deaths by the managing entities, we can see this here in this graph, and 5 out of 7 managing entities had more than 1,000 fentanyl related deaths, while Central Florida Behavioral Health Network had over 2,000. Again, this region has the highest population, so that makes sense. So to get a better understanding, we can have our breakdown of the death rates per region. So Northwest Florida Health Network had a death rate of 19.4 with fentanyl and fentanyl related deaths. Lutheran Services Florida had a death rate of 40.5 per 100,000 population. Central Florida Behavioral Health Network had a death rate of 32.9. Central Florida Cares had a death rate of 45.5. Southeast Florida Behavioral Health Network had the highest death rate at 57 per 100,000 population. Thriving Mind South Florida had a death rate of 16.7, and then Broward Behavioral Health Coalition had a death rate of 52.2. So we're seeing dramatic increases in death rates with fentanyl and fentanyl analogs across the managing entities. So just to show how fentanyl and fentanyl analog cause death rates have increased over time in Florida can be shown here. So in 2015, the death rate for Florida for fentanyl was at 3.5 per 100,000 population, which is shown in blue. So I don't think there was fentanyl analogs being tested and reported to the medical examiner. So I think that's why fentanyl analog doesn't show up in 2015. It's not to say that fentanyl analogs weren't contributing to deaths in Florida. It's just I don't think they were being reported at the time because it was such a new thing. But it does show up in 2016, and the height of fentanyl analogs were in 2017 which contributed to 7.5 for a death rate. And then just take a look at the fentanyl caused death rate from 2019 to 2020 alone. We're seeing a death rate of 15.1 to 24.3. So this is a huge spike in fentanyl caused deaths throughout the state of Florida, showcasing again that fentanyl is being flooded throughout the state, and it's everywhere and it's in everything. So now we're going to move on to stimulant misuse, morbidity, and mortality. Fatal drug poisonings due to stimulants are also increasing. Florida is experiencing a parallel rise in stimulant misuse, morbidity, and mortality along with the US, and is experiencing similar death rates for both cocaine and psychostimulants like methamphetamine. So in the US, more than 175,000 pounds of methamphetamine was discovered trying to cross the border in San Diego at its largest crossing border. And this is the largest seize of any drug ever in the US for both 2020 and 2021. So the amount of fentanyl and the amount of methamphetamine that is being infiltrated in the United States is an insane amount. The production and the lethal doses of these two specific drugs is just outrageous. In fact, according to the National Forensic Lab Information System, methamphetamine was the most frequently identified drug in 2020. So again, just mass production of methamphetamine is occurring. To go more into depth with methamphetamine and how it's increased in Florida, methamphetamine ranked 9th in the top 10 drug-caused deaths in 2016 in Florida. And as of 2020, methamphetamine is now the 3rd most drug-caused death in Florida. So in a few short years, methamphetamine is now the 3rd most drug-caused death in Florida. And the number of occurrences has dramatically increased every single year since 2016. with the biggest increase in the number of methamphetamine-related deaths occurring in 2020. So this slide is cocaine-related deaths in Florida, shown from 2010 to 2020. For a good portion of the decade, the number of occurrences was fairly stable up until 2015. Then we see a dramatic increase, especially in 2016. 2018 and 19 showed signs that cocaine-related deaths were hoping to be stable again, but then in 2020, a surge occurred with more than 3,000 occurrences of cocaine, exceeding historical numbers. So this breakdown is cocaine-related deaths by managing entity, and we can see the stark differences between each region. But again, by death rate, Northwest Florida Health Network had a death rate of 9.5. Lutheran Services Florida had a death rate of 16.8. Central Florida Behavioral Health Network had a death rate of 15.3. Central Florida Cares had a death rate of 19.1. Southeast Florida had a death rate of 23.1, which is the highest among all seven managing entities. Thriving Mind had a death rate of 15.8, and then Broward Behavioral Health Network or Coalition had a death rate of 22.1. The number of occurrences for methamphetamine, as I said before, has dramatically increased every year since 2015, with the biggest increase occurring in 2020. So methamphetamine-related deaths also saw a 50%, almost a 50% increase from 2019 to 2020 alone. It's predicted that fentanyl and methamphetamine, as I said in the previous slide, will continue to be flooded in the streets of the US and unfortunately will affect Florida as well. And I'm assuming we'll see even higher methamphetamine-related death rates for 2021. So the breakdown for managing entities is different per region. Southern regions, as you see here, the last three have pretty smaller number of occurrences compared to the other managing entities. And to give you the numbers, Northwest Florida Health Network had a death rate of 18.7, and this is the highest rate of methamphetamine-related deaths among all the managing entities. Lutheran Services Florida had a death rate of 14.8. Central Florida Behavioral Health Network had a death rate of 12.8. And then Central Florida Cares had a death rate of 8.3. While the last three, like I said, all had a death rate of from 2 to 3 per 100,000 population. So much lower death rates for methamphetamine-related deaths in the southern regions versus the northwest region of the Panhandle having higher rates of methamphetamine. So this slide is the number of cocaine and methamphetamine caused deaths from 2015 to 2020 in the state of Florida. Cocaine is shown in blue and methamphetamine is shown in orange. Cocaine caused deaths is again shown here, and overall has a higher rate of caused deaths over methamphetamine. However, methamphetamine caused death rate has continuously increased since 2015. And as I said previously, I just think with the provisional numbers and estimates, I foresee methamphetamine caused deaths to continue to increase especially for 2021. So moving on to from the medical examiner's reports, these are some new psychoactive substances that are being reported in the US and in Florida. So I just, um, I'm not even going to attempt to pronounce this, so because I've been talking too long. So I'm just going to say ISO. Has been found in the Tampa area and is a synthetic opioid 20 to 100 times stronger than fentanyl. It's often mixed in with other drugs and can be made in pill form or powder. So there's just been some new reports of this substance, and with the lethal amount, being 20 to 100 times stronger than fentanyl. This is a really big concern um, for Florida, especially in that um, in that one region. Also, xylazine is being reported to um, a lot of is making a lot of national news, more than in Florida. But again, it's important to be aware of these substances that may appear on the streets in Florida. Um, detecting new substances is vital when raising community awareness and educating, the dangers of local street drugs. So, with xylazine, to go more into depth, one thing I wanted to point out is that it's not an opioid, and naloxone can't reverse it. So I think specifically this drug is popping up in like the Northeast, but again, I think it's really important to be aware and be on the forefront of what new substances are occurring, and how they could impact your community. So to do a recap of what we've talked about so far, uh, rates of alcohol use have remained largely unchanged in Florida among adults until 2020, with an increase in past year use. However, use of alcohol among youth have decreased, as we talked about with the Florida Youth Substance Abuse Surveys. Marijuana is the one substance used by adults for which the pattern has been consistent over time. Both past month and past year use among adults has been steadily increasing over time. And the increase in Florida parallels that of the US overall for adults. Youth who use marijuana have slowly been decreasing over time. And then vaping among youth has stayed pretty steady as well and decreased in overall rates from the recent surveys. So the later half of the presentation, we talked about drug overdose rates in COVID-19 and how deaths from illegal fentanyl and its analogs will continue to rise in Florida for 2020 and 2021. Um, this this data highlights the need to increase prevention by expanding awareness, harm reduction, and access and availability of treatment across the state. We also touched upon what some drug experts are attributing to as the fourth wave of the opioid epidemic, which are stimulants such as cocaine and methamphetamine. So for Florida, we'll see an increase for stimulant deaths in most likely in 2021 with the provisional data, and cocaine deaths are for the most part evenly distributed throughout the state, whereas methamphetamine deaths are highly concentrated in the northern Florida regions. So here are some really good resources that's been coming out of Florida. I also want to highlight there's been some money, some federal money going into more naloxone and fentanyl test strips. So I just want to highlight those resources on the federal level. Again, on the state level, the Department of Children and Families has a great amount of resources regarding substance use prevention and treatment on their website. And then Dose of Reality is a website where you can find helpful information about the opioid epidemic in Florida with specific statewide resources for opioid addiction. And we have a short video that describes Dose of Reality in depth, and I think it's going to play right now. So, so that's a really good resource to have, and just showcases that Florida is really from the top, really considering that the opioid epidemic is a real problem in Florida, and that they're really focusing on providing education and treatment and awareness um, for to prevent overdoses and also addiction in Florida as well. I'll go more in depth with the syringe exchange programs on the next slide, but then lastly, I Save Florida is a great resource, especially to locate Narcan in your community. So I just wanted to update this type of resource, this type of harm reduction service that Florida has been increasing throughout the years, which is syringe exchange programs. This graphic is the most up-to-date on where to find syringe exchange programs in your region. And so the explanation of the colors, so yellow counties is a county with operational syringe exchange programs. The orange is a county with an executed letter of agreement, and the blue county is with approved county ordinance to have a syringe exchange program. So I just want to highlight the importance of and the importance of syringe exchange programs and how they can be a really good resource to help those who use drugs, facilitate safe disposal and contamination of needles, and can also decrease infectious diseases. And then this slide just indicates where I received all of this great secondary data that I gathered for all of you today. And some of these are really helpful in case you need some data or utilize some data in your regions or local communities as well. And so I just want to thank all of you for your attention. And here's my contact information. I'm going to hand it over to Rebecca, and I think we're going to take some questions now. Thank you.
Okay, everyone, I'm going to look through the chat and I am going to see if we have any questions. I saw one that said, are the percentages listed anywhere in terms of the chart? The bar graph visual leads one direction, which is different than the percentages reported. Do you have any conclusions you can share with anyone on that?
Let's.
I believe this was about when you were showing the fentanyl graphs.
Mm-hmm. I'm trying to think which slide they're talking about.
And if we can't find it right now, if you would like to send Ben a message, as you can see, he's got his contact information up, and you can ask him more questions from there as well.
Yeah, that'd be great.
And then also, Ben, someone asked what, if you will just tell them what a FET analog is again, one more time, FET.
Yeah, so we know that like fentanyl is a illicit produced substance, and basically in these illicit laboratories, people are changing the structure of the chemistry of fentanyl, and so if you see a slight difference in the chemical structure of fentanyl, then that's considered a fentanyl analog. So they have like similar properties. Fentanyl analogs have similar properties to fentanyl, but they're not, the chemistry of it might be a slightly different.
Ben, I have another person asking, and you may not know the answer to this, so if you don't, that's okay. But someone asked if fentanyl testing strips were illegal in Florida, and if you knew.
Oh, that's a good question. I just talked to someone actually who works in harm reduction. I think, oh, I don't want to say anything. I don't want to say anything that's wrong. So I will have to look that up again. I think there's a lot of restrictions with fentanyl test strips. But yeah, that's all I need to say. I don't want to give out false information.
No problem. That's why I prefaced it with, I'm not sure if
Yeah.
you know. Figured
Yeah,
if
no,
you did, it'd be
it's a good
a good
question
time.
though.
It'd be a good time to ask. Well, I don't know if you can see in the chat, but you're getting a lot of high praises. People have said it was a great, very organized, wonderful presentation full of great data. So thank you so much, Ben, for your time, and thank you for doing this webinar and pulling all of this information together for us. We really appreciate it.
Yeah, thank you so much, everyone. I hope you enjoyed the presentation, and thanks, Rebecca.
Of course, we'll have a good morning, Ben. Ben's in California, so it's really early for him.
Thanks. Bye.
All right, bye. All right, everyone. We've included Ben's contact information so that you may reach out to him with any further questions that you may have. And as stated before, Ben, thank you so much for all the work you put into this presentation. We really appreciate it. A couple of items of business to note before we conclude today's webinar. Please see the chat panel for a link to today's survey. Additionally, when I conclude today's webinar, your browser will take you to an evaluation on FATA's website. You want to log in to receive CE credits or a statement of credit. You need to take this evaluation in order to receive them. You will be prompted to register or sign in to complete the evaluation. You can register as a visitor at no cost. For CEs to be reported to CE broker for Florida licensed healthcare practitioners, you must provide an accurate Florida Department of Health license prefix number the first time you register. After you register or sign in, you will be directed onward to the evaluation. You must use the same email address you used when you registered for this webinar as you have set up in your FATAS profile, as this is the only way to connect your attendance and your profile. You will get a second opportunity to complete the evaluation through a follow-up email later today. The sender will be messenger@webex.com. Please remember the evaluation will close midnight Monday, June 20th, and we cannot open it after that day. We do not email statements of credit. Instead, after we verify attendance and completion of the evaluation, a statement of credit will be generated as a journal entry within your profile 30 business days after the evaluation closes. Thank you for participating in today's webinar, and we'd also like to recognize and especially thank the Florida Department of Children and Families Office of Substance Abuse and Mental Health for funding today's education. And one more time, please remember the evaluation will close midnight Monday, June 20th. Thank you all and have a great day.